Pam, how are you doing?
Hi, Dr.
Being diagnosed with heart disease can often be frightening and life-changing, and what I want to offer to my patients is hope. Oftentimes, when patients come to see me in the office, they're having symptoms like chest pain, shortness of breath, or palpitations. And that's where I, as a cardiologist, come in, trying to figure out what's driving these symptoms, finding a diagnosis, and treating them to allow them to get back to their life. My name is Dr. Caitlin Ibrahim, and I am a general cardiologist with the Lankenau Heart Institute. As a general cardiologist, I see a wide variety of patients with cardiovascular disease, ranging from heart attacks to coronary artery disease, to abnormal heart rhythms, heart failure, and vascular disease. And I also see patients who are worried about their heart health, those who may have a family history of heart disease or risk factors for heart disease who want to decrease their chance of getting heart disease in the future. There are many different kinds of tests that we can do to diagnose heart disease. Some of the most common tests that I order are echocardiograms, stress tests, heart monitors, and CAT scans of the chest. There are many different treatments for heart disease, ranging from lifestyle interventions to medications to procedures. Once I determine a diagnosis for a patient with heart disease, oftentimes we're choosing specific medications tailored to their diagnosis to help them feel better. If we need to, then we can refer to our other specialists. Being a part of the Lankenau Heart Institute means having access to these advanced subspecialists, including interventional cardiologists, electrophysiologists, heart failure physicians, as well as cardiac and vascular surgeons. To me, being a physician and being a cardiologist means getting to know my patients, getting to know who they are, what's important to them, what they value, and what they're going through, and figuring out the way to best partner with them to determine how I can help them to feel better. There are many things that we can do to reduce our risk for heart disease that don't involve medication, the top of which being diet and exercise. And as a former Division I track and field athlete, I bring my real-world experience with diet and exercise and coaching to my interactions with patients to provide an additional level of care. As a cardiologist, one of the most exciting things is to be able to offer my patients new and cutting-edge technology. Nowadays, there are more minimally invasive procedures. We can fix big problems with smaller incisions. We can implant new and smaller devices inside the heart. And most exciting is that there are new wearable technologies that patients can use at home to keep better track of their heart rate and their blood pressure and help them be empowered in their own health. And all of these new technologies ultimately mean providing the best outcome for our patients and helping them feel better and getting back to their life sooner.